like that upper trap and lower neck restriction in here
Mm-hmm.
on both sides.
I have constant pain up there.
Yeah. Okay. All right. Let's check your back here. Let's have you lay face up there for me.
Okay.
All right. And then right here, I'd like you to lift both legs and then up to about my hands, and then don't let me push down here, okay? Any pain with that at all?
A little bit of soreness in my lower back.
Not
It
major
doesn't
pain?
hurt like
Okay.
majorly, but
Yeah.
it's hard for me to keep my legs up.
Okay. Let's try one more time for me, and don't let me push down here. Any pain with that?
No.
Nope. Okay, you can relax right there for me. I'm gonna come check something else here. Put your arm directly out to the side for me. Right there, like sticking out. Right there. Hold it right there. Any pain in here?
A little bit,
A
yes.
little bit. I'm gonna get a little bit deeper here, okay? Any pain in here?
Yeah, it's
Yep.
sore in there.
Okay, sorry. Anything in here?
No.
No. Here?
Yes.
Yeah.
Yep.
Here?
Yes.
Yep. Check the other side here. Here?
No.
No. Here?
No.
No. Here?
No. Yep. Yep.
Okay. Do you hear grinding in your shoulder?
Yes, I do.
Yeah.
Yeah, that hurts really bad. Oh, yep, right there.
Sorry.
Yep.
Right there.
Yeah, that's pretty painful. Okay, yep.
Sorry. This is no longer testing. We're actually doing some release techniques here. Okay, right there. Okay. All right, you can relax here. All right, very good. I'm gonna help you up here. So I would, in this situation, I would approach it a couple of ways. Did anybody, when you had physical therapy before, get into the joint like that?
No,
Nope.
they did not. They made me just do like circular motion, like
Yeah.
more stretching activity.
Yep.
There is no like actual physical touching.
Right.
It was more for
Just
military.
Yeah.
They give you a pamphlet and they
Right.
send you home
Right,
with a
right,
pamphlet
right,
on
yeah.
stuff you went over, and they
Yeah.
tell you to just continue to do it.
Okay, so the issue is that when we have adhesions that are really deep inside the joint, again, we talked about scar tissue, right?
Yeah.
Whenever there's an injury, and you said this happened after an accident.
Yes.
Okay, do you remember the positioning of your arm when you had that accident?
I actually went over the handlebars and
Yeah.
I blacked out. I
Okay.
hit my head and my shoulder, I believe, and my knee hit the handlebar.
Okay, got you. So you hit your head and shoulder on the ground?
Yes.
Okay, so you possibly went shoulder and injured your shoulder somewhere upon impact, right? So that's where we have to find out what the problem was, right?
Okay.
There's a lot of soft tissue that is in that area. We have labrum, right? We have all of our tendinous connections into the bony soft tissue here.
Yeah.
We have a capsule around the shoulder
Mhm.
that protects the shoulder that could have adhesions in it as well. There's a whole bunch of different layers of soft tissue that could be injured, right? What I would do in somebody like this, in a situation like this, is I would do some active release technique.
Okay.
I would possibly recommend some sort of dry needling, something that gets in there and tries to break up these deep adhesions, right?
Okay.
Sometimes if we can release these deep adhesions, we may be able to restore full function, right?
Okay.
However, if there is a micro tear in there that's never been addressed, no matter what we do, it's not going to correct it.
Okay.
In fact, some techniques may make it worse, right? We would, of course, we wouldn't be doing any of those techniques. What we would probably do at the beginning would be active release technique, soft tissue technique, so on and so forth, to try to see how you respond to care. Okay. If there was no response to care, then after that, I'd probably recommend to go get an MRI, because the shoulder X-ray is not going to tell me anything in there.
Yeah.
An X-ray is just going to show the bone. We already know it's not broken because this is a long time ago.
Yes.
And if it was broken, it's going to heal by now. So now we're talking soft tissue. Let's see
Okay.
the soft tissue. So MRI is the best option for you.
Okay.
Okay, I would still use, like I said, for therapy here, I would use some active release technique, neck adjustments, upper back adjustments, so on and so forth.
Okay.
Low back, same thing with adjustments, but for the shoulder specifically, I would probably myself do active release technique and get you in with our sports therapist to do some active release technique as well and try to release that joint.
Okay.
Okay, with that said, we're going to set up and show adjustment on film. Okay, we'll talk a little bit about the shoulder, how you're having some issues. You had physical therapy before, other exercise therapeutic modalities, how we feel that we need a little bit of deeper technique. If at that point, upon deeper techniques, soft tissue releasing techniques, we don't find any changes, at that point we'd probably recommend an MRI. Go ahead and go like this for me. Back down to neutral. Come back up. 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 Not as bad?
Not as bad.
Cool. Right here. Come back up towards me. See, trying to give me a little backhand for saying that Tex-Mex is way better than Texas. Yes, it is. Feel that there?
Yep.
Okay, we're doing a little bit of active release technique here. Sorry.
Oh Lord. Oh.
Extend up. There you go. Extend up. Good job. Extend. There you go. Okay, you can relax there. Sorry. All right. So we're gonna use that's active release technique on the shoulder. How does it feel right now?
It feels a little bit more loose.
Looser? Okay.
A little bit less like painful, I guess.
So we're gonna get it. I mean, of course, when we press on it, it's gonna be super sore.
Yeah.
Especially if we do have an adhesion in there, like a labral tear, which I don't think we do,
Okay.
but it could be in there, right? But if we do have a tear that's deep in there, this is gonna feel good right now, and then it's just gonna kind of keep coming back.
Okay.
There's nothing that we're gonna do that's gonna worsen the situation. If it's just what we call an adhesion, like a scar tissue.
Yeah.
If we break this up, it should release your issues.
Okay.
Okay, but it'll take some
Take a
time to
while.
discover this. Okay.
Okay.
So we're gonna just perform adjustment here.